Unveiling the enigma. Hospital, day. Dr. Alexander, mid-20s, just finished residency, is bustling around the hospital, dealing with patients and their families. His pager goes off, and he checks the message. Nurse James approaches. Nurse James, another patient for you, Dr. Alexander. Room 308. Dr. Alexander enters the room to find Sarah, mid-40s, sitting up in the hospital bed, looking pale and weak. Her husband, Mark, 50s, is by her side, holding her hand. Dr. Alexander: good afternoon, Sarah. I'm Dr. Alexander. How are you feeling? Sarah: I've been better, doctor. I'm constantly tired, and I have this constant pain in my abdomen. Dr. Alexander: I'm sorry to hear that. Let's try to figure out what's going on. Dr. Alexander takes down Sarah's medical history, asking about her symptoms, past illnesses, and family history. Dr. Alexander conducts a thorough physical examination of Sarah. He seems concerned as he palpates her abdomen. Dr. Alexander: I'd like to run some tests to get a better understanding of what's causing your symptoms. We'll start with blood tests and imaging. Dr. Alexander reviews Sarah's imaging results with radiologist. Radiologist: there's a mass in her abdomen, but it's unclear what it is. Dr. Alexander: the first need to know more. We'll have to do a biopsy. Dr. Alexander updates Sarah and Mark on the test results. Dr. Alexander: we found a mass in your abdomen, Sarah. We need to do a biopsy to determine what it is. Sarah looks scared but determined. Sarah: let's do it. Dr. Alexander, wearing a lab coat and gloves, carefully examines the biopsy sample. Int. Dr. Alexander sits with his mentor, Dr. Wilson. Dr. Wilson: this is an unusual presentation. You'll have to dig deeper and think outside the box. Dr. Alexander interviews Sarah and Mark further, asking about recent travel, occupational exposures, and other possible risk factors. Sarah: we recently traveled to South America. Could that be related? Dr. Alexander: it's possible. Let me do some more research. Dr. Alexander pores over medical textbooks, researching tropical diseases and their symptoms. Dr. Alexander consults with other specialists, including an infectious disease specialist and a gastroenterologist. Dr. Alexander enters the room with a sense of urgency. Dr. Alexander: Sarah, I believe you have a rare parasitic infection called biliary fascioliasis. It's caused by a liver fluke that you likely picked up while traveling in South America. Mark: is it treatable? Dr. Alexander: yes, it is. Dr. Alexander: we'll start your wife on a course of medication called triclabendazole. It's the most effective treatment for this infection. We'll monitor your wife progress closely, and I'm confident we'll have her feeling better soon. Sarah: thank you, Dr. Alexander. Dr. Alexander writes out the prescription for Sarah and hands it to Nurse James. Dr. Alexander: please make sure Sarah gets started on this medication immediately. Nurse James: will do, doctor. Sarah is administered the medication by Nurse James. Over the next few days, Sarah's condition gradually improves. Sarah, looking much better, is sitting up in bed. Dr. Alexander enters the room, smiling. Dr. Alexander: Sarah, your test results show that the infection is under control, and your symptoms have improved. I think it's time for you to go home. Sarah: I can't thank you enough, Dr. Alexander. You've saved my life. Mark: we're both incredibly grateful. Dr. Alexander smiles modestly. Dr. Alexander, it was a team effort. I'm just glad we could figure it out and get you on the road to recovery. Sarah, Mark, and Dr. Alexander stand by the hospital exit. Sarah and Mark say their goodbyes and leave the hospital together. Dr. Alexander watches them walk away, satisfied with his work. Dr. Alexander talks with Dr. Wilson about Sarah's case. Dr. Wilson, you did a great job on this one, Alex. You were persistent, thorough, and didn't give up until you found the answer. Dr. Alexander, thank you, Dr. Wilson. I learned from the best. Biliary fascioliasis is a rare parasitic infection caused by the liver fluke Fasciola hepatica. The infection typically occurs in humans who consume contaminated freshwater plants, such as watercress or lettuce, that harbor the parasite's larva. Once ingested, the larvae migrate through the digestive system, penetrate the intestinal wall, and enter the liver, where they mature into adult flukes and migrate to the bile ducts. Symptoms of biliary fascioliasis can include abdominal pain, fever, nausea, vomiting, and jaundice. In some cases, the infection may be asymptomatic. Diagnosis of biliary fascioliasis may involve imaging tests, such as ultrasound or computed tomography, CT, which can reveal the presence of flukes in the bile ducts. Blood tests, such as enzyme-linked immunosorbent assay, ELISA, can also be used to detect antibodies to the parasite. Treatment typically involves the use of anthelmintic medications, such as triclabendazole or albendazole, which can kill the adult flukes. Additional supportive care, such as pain management and liver function monitoring, may also be necessary. With prompt and appropriate treatment, the prognosis for biliary fascioliasis is generally good, with most patients making a full recovery. However, in some cases, complications such as biliary obstruction or secondary bacterial infections may occur, leading to a more severe or prolonged illness.